Hello, my name is Dr. Alice Hyun-Kyung Tan, and welcome to my presentation on the reopening of society in the context of COVID-19 in Korea. Since the pandemic started in December of 2019, it has caused massive death and disruption of lives everywhere. Fortunately, in Korea, thanks to the great effort of our doctors, nurses, public health officials, government, private businesses, and ordinary citizens, we are now at a stage where we have eased social distancing measures and are reopening sectors of society one by one. We know that this will not be a smooth or easy process, and we recognize the possibility of having to move back to stricter social distancing if we notice that COVID-19 is starting to spread again. Nonetheless, we have started the transition, and today I'd like to share some information with you about that process. Korea eased social distancing measures on May 6th, but many people are concerned about our readiness. The most important consideration is, of course, safety. We need to consider the safety of our healthcare workers, the safety of not only COVID-19 patients, but all patients in Korea, everyone with chronic and acute health conditions, and the safety of the public at large. Anytime we make important decisions, we need to weigh the risks and the benefits. And in the case of opening society in the midst of COVID-19, we need to clearly delineate between the necessary versus optional and make sure that we prioritize what is essential. We need to ask and answer the following questions. Is the healthcare system in our country ready for society to reopen? More specifically, can hospitals operate normally without running the risk of collapsing when we reopen? Since we have already seen in Wuhan, northern Italy, and even in Daegu, that this risk of collapse is very real, and it's not a risk worth taking if we have the choice. If we do not have enough doctors, nurses, supplies, and equipment in a region because of the need to take care of an overwhelming number of COVID-19 patients, then everyone suffers. Cancer patients may not get the life-saving surgeries and treatments that they need. People coming in for emergency treatment, such as heart attack, stroke, or accidental injury, may need to be shuffled from hospital to hospital, desperately looking for a place to get treated. Or life-saving blood or medication can run out. The chain reaction leading to more death and illness when a healthcare system gets overwhelmed is catastrophic, and it affects everyone. Next, is the public health system ready? Are there mechanisms in place for dealing with COVID-19 now and COVID-19 in the future? And of course, the future is very difficult to predict with COVID-19, so we need to consider and be ready for the worst case scenario. There are questions to be asked of the public too. Are we as a society made up of individuals and organizations ready to reopen? Let's look first at the readiness of hospitals in Korea. Public health leaders have been analyzing the situation closely, and they have done the math. There are between 100 and 110 negative pressure critical care beds available in Korea that can potentially be used to take care of the sickest of the sick, COVID-19 patients. Given that a very sick person with COVID-19 is admitted for an average of 20 days, they estimate that the maximum number of new patients per day that our country can safely tolerate is 50. For the last few weeks, we have achieved this goal. We have a system for classifying patients according to their degree of illness and transferring them to the appropriate facility within a national network of designated hospitals. Also important is the overall trend in new cases. It needs to be stable or downtrending, and there needs to be only a few, ideally no cases with unknown epidemiological link. This last detail is important because if we identify a COVID-19 patient, but can't figure out where, how, or from whom this person caught the virus, then this tells us that COVID-19 is likely spreading silently, unchecked in the community. And this, of course, is very dangerous. Another criterion that needs to be satisfied to open the country safely is surge capacity. We have seen this pattern multiple times already now. COVID-19 circulates widely under the radar in a city for weeks, and then all of a sudden, there is an explosion of cases that puts a tremendous strain on the healthcare system in that region. We know that what happened in Daegu can happen again, and we need to be prepared for this type of situation. We need to make sure that we have enough masks, gowns, ventilators, doctors, and nurses to take care of large numbers of patients all at once. And if there is a supply gap, the government needs to step in right away to reallocate and redirect the production and flow of resources to where they need to go. To be honest, during our peak in Korea, we were scrambling to find hospital beds for our patients. And we recognize now that more negative pressure critical care rooms need to be built in our country in preparation for the next wave of COVID-19 or the next epidemic, whatever disease it might be. Before a country opens up in the age of COVID-19, there needs to be a robust and effectively functioning epidemiological system in place that is able to detect and diagnose cases early, isolate positive cases and quarantine probable ones, and track and trace all potential close contacts. Why? Because this is a highly contagious disease that is transmitted very easily from person to person. And this is the only way, without lockdown, to keep society afloat. In Korea, we now have one of the world's most effective systems to accomplish this type of intensive epidemiology and public health. There also needs to be a system established to monitor the situation closely, both in detail and also as a broad picture, so that infection hotspots and trends can be identified, followed, and acted on. Korea's IT COVID-19 case management platform has been working well for us so far. The next critical piece is the readiness of the public. The public needs to be aware of the situation and what sorts of infectious disease prevention measures need to be taken, why they are important, and how to follow the guidelines. Also, the public needs to be prepared by having masks and disinfectant readily available. And very importantly, they need to be willing to comply. As I stated before, a unified response is crucial to gaining control over COVID-19. All it takes is one infected, highly mobile person to cause thousands of cases in a relatively short amount of time. And just because your community is not affected now does not exempt you from participating, because in the absence of strict universal isolation, in one way or another, we are all connected and vulnerable to COVID-19. So, everyday infectious disease prevention measures need to be practiced all the time by everyone. Motivating the public, especially young people, to participate fully and actively is essential. And Koreans seem to be ready to take on the responsibility of following the guidelines for infectious disease prevention in everyday life. The goal of lockdown and extreme social distancing is to break the chain of transmission all at once. As long as the SARS-CoV-2 virus has its next host, any person without immunity, close by to hop into, it will continue to live among us unless we rigorously follow these guidelines, which we've all been practicing for the last 3 months. Physical distancing means keeping a safe 2-meter distance between yourself and a stranger. Washing hands is probably the single most effective way to prevent COVID-19, and it should be done for 20 to 30 seconds with soap and running water before you eat, after you use the toilet, after touching shared surfaces, and every time you return home from being outside. Covering coughs and sneezes, wearing a mask, and staying home if you are sick, these simple actions prevent the virus from spreading to others. Businesses and institutions also have a significant role to play. All establishments that are of the type that have seen clusters of COVID-19 patients should be doing fever checks at the point of entry. This would include churches, fitness centers, clubs, bars, hospitals, nursing homes, internet cafes, ships, and workplaces in which employees are seated close to each other in an enclosed space, such as a telephone call center, or a food processing factory, or a dormitory for migrant workers. I would suggest that sanitizing the affected area is just not enough. Checking for fever is one of the simplest ways to detect potential patients. Over the last 5 months, COVID-19 has been showing us how it behaves. The quicker we learn from the painful examples of others around the world and modify our businesses and organizations to be resistant to infection, the faster we will be able to conquer COVID-19. In the case of COVID-19, the safest way of thinking is, if an outbreak happened in X establishment there meaning Korea, Wuhan, Italy, or New York City, then it can certainly happen here. And I'm talking about rural North America, South America, and Africa, basically the next targets of COVID-19. So the reflexive next step should be being proactive to prevent similar cluster outbreaks from occurring in your community. There should be a rearrangement of furniture and newly designed procedures to prevent crowding and to facilitate physical distancing. And disinfecting and ventilating indoor spaces, in addition to standard cleaning, needs to be our new normal. As a doctor, I've had to resuscitate dying patients, and I'm always thinking about how to keep my patients alive and well. I'm not an economist, but I'm fairly certain that one of the best ways to kill a dying economy would be to ignore the guidelines of public health experts regarding COVID-19 and to think that a region can open up without taking into account at least all the points that I touched upon in this presentation. Doctors and nurses normally follow strict infectious disease control measures in hospitals all the time to protect our patients, to protect you from infectious diseases like COVID-19. It's hard work, and it takes time and practice to make it a habit. As a doctor, I am asking you to also be a healthcare hero by doing as doctors and nurses do. Help protect yourself and others. Care deeply about keeping yourself and our country safe by making infectious disease prevention part of your everyday life. These are the ways to reopen society and transition safely from strict social distancing to a more normal life. Thank you so much for listening, and please stay safe.